Hi, my name is Esther Oluwatosin. Be magnificent. Yeah, be magnificent. So I am here to share my story on my journey to motherhood. Yeah, if you would know me personally or before now, you would know I got married in 2022 February. Yeah, it's really not been a smooth journey getting here. But all I can say is God is faithful because that's the summary of the story. God is faithful, is trustworthy, he can be trusted. So I would like to share a few snippets of what this journey looked like. It was not a smooth one, I must confess, but I saw the hand of God through and through. I heard his voice, he spoke to me, and it was clear, and I am living in the fulfillment of what he had spoken. So, if I'm using this moment to encourage anyone that might be going through any storm, any dark road, any dark season where you beginning to lose hope, or you've even lost hope, or you're thinking I've come to the end of myself, there is no help for me. I'm here to tell you that your help comes from God, and he can see you, he can hear you, he knows you, and his thought of you is to give you an expected end. So I would like to briefly start with how the journey started. Yeah, it started in 2022. I got married, and this euphoria of newly wedded couple. Oh, usually society expects that you would want to give birth immediately, but no, that wasn't the case for me. My expectations were I'm going to first enjoy the first 6 months of my marriage before trying for a baby. Yeah, but the anxiety nature in me wouldn't allow, because of, I think, based on my previous experience or exposure, the thought of, oh, when you have sex, the next thing is boom, you're pregnant. I think that's based off of what we've watched from the screen. So my thoughts were, oh, I'm going to conceive immediately, and this journey started. This journey started. I became very anxious. I became very worried in the first month. Oh, okay. In the first month, well, I think on my wedding day I was menstruating, and I didn't really think much of it because my husband had to travel back. But I joined him in the next month, and I saw my cycle. We tried. Before then, I thought I had enough knowledge, but I was blank head, which it was intentional. But again, if I was to look back and rewrite it, I would have done better, because I knew next to nothing about counting ovulation. I knew next to nothing about safe period, nothing. Like, I was a total mess. Believe me, I was a total mess. Just bear with me. Yeah, when I said I was a total mess, I knew next to nothing. I started learning. I became really worried. I couldn't speak to people. My husband was like, "Why am I worried? The marriage is just quite early. We're not even 6 months." And I'm like, "What's this guy saying? I thought you get pregnant immediately you have sex. Is that not what we've been told? So why is mine different?" Oh, the pressure was much. I would say I kept a lot of pressure on myself. It was really daunting. It's not a good space to be, because I've had this expectation, and I want to mention even one of my greatest fear, especially in COVID, was the fear of getting married and not conceiving. I didn't know where that fear came from. We will come back to that, but that's by the way. So I kept on being worried. Every month I'm looking forward to cycle, and boom, it's here. Because I am really, really very accurate. My menstruations are spot on. That's really what I know. And I feel like everything is right. So long I've seen my menstruation, I'm not pregnant. There's no even way. So now that I'm married, why am I still seeing this guy? I don't want to see you again. Can you stop? So, but it kept on coming. Then after a few months, because I was worried, my husband began to give it attention, and yeah, he started okay. Then we started okay, yeah. I'm not waiting, please. I'm not waiting for 6 months. What's happening? I'm no longer waiting. To be honest, I didn't enjoy sex. I didn't, because I'd put a lot of pressure on myself. I was thinking I should be pregnant already. What's happening? Is this my fear coming to realization? Like I said, in 2020, I think during COVID, I didn't know where this sudden fear came from. It was just always coming to me. What if you can't conceive? What if you get delayed and whatever? And now looking back, I think, yeah, I allowed the fear of other people's experience, projection, maybe out of sympathy, because then am used to being worried for people, especially when I know they are trying. It gives me concern. I pray for them. I put myself in their shoes to say, okay, what would they be going through, dealing with society expectations, and now I'm in that shoe. It was a tough one, anyways. Dealing with my thought of, this is not my fear coming to pass. And remember the story of Job, where it says, what I feared the most had come to pass. So on and on and on. First month, second month, third month, 6 months, 7th month. Then all of a sudden, I began to take supplements. People would say, okay, take supplements when you are trying, prepare your body, take folic acid. I started on those things, but over time, I began to see that my cycle began to change. I'm like, okay, what's going on here? My cycle is pretty complete. What was making my cycle not accurate again? Then we began to buy this test strip to check ovulation days and everything, just to be sure that we are meeting at the right time and all of that. This pressure was much, because everything I'm just thinking is getting it on getting it on time. I remember vividly, I was I didn't mind the cost of this test strip, and I think we decided to speak to the GP after 6 months, telling them we're trying for a baby. And yeah, and they were like, okay, I'm still young, we should keep trying, we should take our supplement and all of that. Yeah, we went back and we were doing as we were told, but the cycle became messed up. And at some points down the line, I think towards the end of the year, I began to feel this strange pain that comes with my cycle, and I'm like, how did I get here? Usually, when I see my cycle, I do not get any pain, next to no pain, except if I had taken junks few weeks prior. But usually I wouldn't explain. This pain was strange that I woke my husband. My husband was like, what's going on? He started making calls, and a family member was telling us it could be dysmenorrhea, or I don't know what it's called, the medical term. And I'm like, no, I've always had a smooth sail with my cycle. So we went to the GP and they told me to go and get ibuprofen to, well, this thing persisted, and I'm like, something is not all right. So I kept on calling the GP, and Viola, I was scheduled for a ultrasound, and this is where we had the great review. So I went for an ultrasound, which was in December, and we got the biggest shock of our lives, of my life to say, because it was from that point everything became really drowsy, cloudy, whatever vocabulary you could give to it. I did the scan, the results came out, and here I am presented with ovarian cysts by, ovarian cyst of my right and left ovary. One was bigger, and I was told I will need to be scheduled for a surgery. And you know how things are with the health system here, you have to be on a waiting list. Considering again that it's not like it's an emergency. Then it looked like my hope is beginning to be dashed. Okay, so now the focus is no longer on conceiving. The focus is now more on getting this surgery done, getting my fallopian tubes separated, because apparently with the situation of things there, I couldn't conceive. My fallopian tubes were joined together. Even if I had conceived, it will most likely be an ectopic one at the end of the day. Then it was a difficult time. It was really a difficult time. We started contacting doctors online because the health system here was pretty slow. If there was anything we could do to help with the cyst, and we were told that it's still the same. would have to wait for the surgery, and it's not safe conceiving with that situation of my reproductive organ being messed up. So we waited. I was on call. I kept on checking, following up. When will it be my turn? Then my GP gave me the option of referring to a private facility, which I took because I knew I was told I could wait a year if I was to wait for the NHS. So he referred me, and doesn't mean there's still no waiting list. There was. I waited for about 6 months, if I'm correct. Was it 6 or 5? Then something happened. So during that time while we were waiting, we were still trying, keeping our fingers crossed, trusting on God. And also we were contacting doctors online. I do not pray for my enemy to be in this situation. I see different doctors online, tell my husband, I've seen this, I think they could be of help, let's try them, other medications and whatnot. So I met this popular doctor. People said she came highly recommended. She has helped several people. This, that. Oh, need I mention the results from the ultrasound that I did not only find out a bi bilateral ovarian cyst. He found out again that the cyst was not just an ordinary cyst. It was a chocolate cyst, which then means that my enemy had endometriosis, because I struggle to accept such reports even until today, and I won't accept it. It's the devil's report. Okay, so now there's a diagnosis: endometriosis. What is endometriosis? I've never heard of endometriosis in my life. Then the question began. I began to research, okay, if there's a diagnosis, is there a cure? Is there a prevention? Is there a treatment? It was a lot. Then I began to find out that there has never been really any solution to endometriosis. They could only identify the problem, but there was no solution. Then I turned to God. How is it that I'm having a problem without a solution? That was even really what broke me. Not really the diagnosis. The fact that there's a diagnosis, but there's no solution. And there's no specific reason. Okay, what could cause? They said infection. They were not just sure. They were just picking data from different sources and whatsoever. So that's it about that. Now I know there's an endometriosis somewhere, and endometriosis is one of the highest leading cause of infertility. And yeah, there's an infertility, maybe, which is likely the reason why I wasn't conceiving. So my husband was also sent for sperm analysis. It was okay. I was told it was good. So that means the problem was from myself. We needed to do the surgery and try again. So fast forward to, like I said, we've been using medications. I found out the doctor online. We ordered, and at that point, we put our feet together since we were waiting for. And this was almost a year then after the ultrasound, because we were on waiting list, like I said. And we met this doctor. She sent us medication we bought. She told us how to use it, and we prayed. We did what we were supposed to do. We used it, and God came through. I was pregnant. That was the first time in almost 2 years I got a positive pregnancy test. I'll share with you what happened around this period of time. The devil struck. Yeah, he did what he knows how to do. But again, God's time is usually the best, and God knows everything. Everything is clear to him. And another thing I would say is God loves me. I don't know, but he loves me. And yeah, I'm not going to say I lost hope, but I stopped believing because I couldn't find answers. There was no help. There was nobody I could turn to. I felt helpless. Even the doctors I was speaking with online, they just said, "Oh, endometriosis is a very difficult thing. They don't take patients for that. It's not easy to monitor or online, but we can only do trial and error." And I'm like, okay, yeah, I'm happy to do trial and error. It won't cost me anything if I do try and error. I could be lucky, never can tell. So we tried the drug, and lo and behold, I found out I was pregnant. I didn't know. First time ever. We thought this journey was going to be over. Yeah, while I was really happy about it, and but again, I had this cold feet because I knew I had not done the surgery. And I was told earlier on that there's a high chances that it could be ectopic pregnancy if I conceive eventually, which would mean it's an high risk pregnancy, and hence it's not viable. So after a few days, during that time, some things happened in the office, and the devil came raging. It came for me. It came for my head. But Mercy said no. I didn't know I was pregnant at that time. There was an incident in the office where I got pierced by an infected patient. That's another testimony on its own, and I'll have to do a recording for that. I got pierced, and it looks like my world was crumbling. Would I live with a terminal disease, or because I'm looking out for my daily bread? Have I come to this country to cut short my life? A lot of things were going on, not knowing I was even pregnant, and it was just the devil way of trying to terminate the pregnancy. Because if I look at it, that was just what it was. So that happened, and along the line, like we said, because we were actively trying, I was always wanting to check: has it happened? Has it not happened? Am I going to wait for the next cycle? As this is the end of the world, is this whole thing coming to an end this month? So I checked while my husband was not at home, and I think it was positive. I was happy. My joy knew no bounds. But yeah, I was happy. I think I spoke with my husband, and that time we were not on good terms, I think, because of the incident that happened in my office and how we managed it. So we found out I was pregnant. We were so happy. Then few days leading to the announcement, I began to feel pain, discomfort on my left side, which was unusual. I was worried. Then I was at my husband went to office. I told him I needed to call the hospital A&E. It was just a total mess. And they said I should find my way down. And one thing with the emergency here is once you are not lifeless, they won't come. I was told to get a Uber to bring me over to the hospital. We got to the hospital again. They didn't attend to us immediately. We were just there, waiting. And I was told because the pregnancy is not up to 8 weeks, they can't give it urgent attention and whatever. I was just there hopeful, and the midwife that was to see me, attend to me when it got to my turn, she was really blunt. She was quite blunt, and she was like, what will be, that there's nothing I can do to hold it. If this pregnancy was meant to stay, if not, it would drop. So I should just go take paracetamol, use pain relief, which was paracetamol, and hot water bottle, and just stay calm. Lo and behold, I went home because they were not going to do anything, as she has said. And I think the next day my husband went to work. It was really important, and I was at home. I checked some video where they said I should stretch, or you could do a pregnancy. I thought, okay, let me just try anything to just relieve that pain. It could just be a slight discomfort. After I did that, in a few minutes I began to bleed, and my whole world came crashing. It was a tough one. We'll continue in part 2. Thank you for watching.